Hello guys, and welcome to this video to learn about alginate impressions. Pretty much an important procedure that you guys will need to do during your entire dental career. And of course, this will allow us to get dental casts of the patients. So that's why it's very important that you guys understand how to do very nice dental impressions with alginate, okay? And I am assuming here that everyone knows already the biosafety guidelines. I am assuming that you know which instruments should be sterile, which instruments should be clean, and that's why I'm not going to cover all these guidelines here in this video as well, okay? Also, we need to understand about the properties of each material. There are different commercial brands, of course, but we are not going to cover this, as we are going to cover important tips to ensure that you guys are able to do a very nice dental impression using alginate. We are seeing here in this clinic that two impressions will be performed. So the first step here would be to choose the correct tray of the patient, right? Because we have different sizes of dental arch. So we need to choose a tray so that the dental arch of the patient will fit properly on this tray. Okay, and then we need how to make sure that it's fitting properly. Well, the teeth of the patient cannot be so close to the borders of the tray. So you try in first, and then you are going to, after you select the tray, then you are going to proceed with your impression. So here in this clinic, two impressions will be performed, an upper impression of the maxillary dental arch and the lower impression, of course. So let's see how this should be done. And before, the first step is that we should remember to shake the package of the alginate material, of the powder, right? So this is another key point that is also very important. Two guidelines described in the literature. So first, you should put the liquids, okay, at a temperature of 18 to 24 degrees Celsius. But again, there are different guidelines described by the literature, right? So if you put the water first, then of course you are going to slowly sprinkle the powder on this water in order to spatulate everything, or to put first the powder, okay? So you know, it doesn't matter as long as you spatulate, creating a homogeneous paste. Very important. So the powder and the water are now being mixed, okay? And of course, take a look at this. The bowl is round, so the shape of the bowl is round, so that with our fingers we can manipulate this bowl in order to change the places of the bowl to spatulate all the places, okay, to make sure that we are creating a homogeneous paste. Now take a look at this. When we know that it's ready, when it's a creamy paste, that it doesn't drip off from the spatula when we lift it up, okay? So this is very important. If you spatulated your alginate and it's falling from the spatula, then it's not ready yet. And we are going now to put the material on the tray, all right? So this is the way that we should put on the mandibular tray. Now let's see the impression of the upper tray. So again, it's an homogeneous paste, and we are now loading this material onto the tray. And now we are even removing some material from the midpoint of the hard palate, because we are not going to use that area usually. And now that's the procedure. We are retracting the cheek with one hand, or the lip and the cheek with one hand, and using the tray itself, we are retracting the other side, all right? And then we can insert the material, and take a look at this. We are now pulling up the tray mostly in the anterior part, because the posterior teeth will also be included just the same, okay? So it feels like you are pulling more in the anterior part, but you are actually doing all the teeth at the same time. You need to retract the lip properly and then pull the lip to try to capture the buccal sulcus as well on the impression, just like this. So you can also take a little bit of the material and insert in the black spaces of the patient if you want to make sure that the interproximal spaces are copied as well. So this is another maneuver that we can proceed with. Now let's see a little bit of the lower impression, and it's actually a very similar procedure. We can retract the cheek using the tray itself, and then after inserting the tray and making the impression, we can actually ask for the patient to lift the tongue, okay, so that we can capture also some lingual tissues. After we remove the tray from the dental arches, you guys will realize that there is sort of a vacuum, and then using this different pressure on both sides, you will be able to remove this vacuum and then remove the dental tray. Okay, so it's pretty much a standard procedure. Now, of course, what we need to analyze? We need to analyze if we captured all the teeth, okay, the interproximal spaces correctly, if that's the case, and then the buccal and the lingual tissues, the surrounding tissues, properly. Okay, so that's how we are going to analyze conventional impression to get a steady dental cast. So if you guys like, please hit the like button and see you guys on the next videos.